religious teachings and obligations. Our tradition also teaches us to care for the disadvantaged. News of recent statistics that vaccinations are not equally reaching many economically challenged communities or people of color, it calls us as people of faith to rectify this wrong. So I am grateful to my friends and my colleagues and fellow spiritual leaders here today who have joined with us in this interfaith vaccination effort. Pastor Rich Wilkerson, Pastor Linda Freeman, Pastor Michael Anderson, Imam Dr. Abdul Samra, and of course our own Rabbi Guido Cohen. We, all of our faith communities, have had to reimagine what together looks like during this nearly year-long pandemic. Today's effort is one where we can proudly practice what we preach. We all hope and pray that soon we will have the opportunity to assist additional members of our community with vulnerabilities. God willing, those one day soon who are under the age of 65. I want to thank our synagogue president, Ronnie Fertig, our many synagogue volunteers, community leaders who have helped us. Thank you to our synagogue professional staff, to our tireless director of synagogue operations, Suzanne Aru Rodriguez, without whom none of these now 1,100 and counting life-saving moments could have happened. May we go from strength to strength, from sickness to health. May we all be safely together again soon, as we all say amen. Please join me in welcoming our own governor, Governor Ron DeSantis.
Well, thank you, Rabbi, and thanks for stepping up and really leading this effort, which is, which I'll say a few more words about in a minute. I actually have two announcements today. The first announcement is I just returned from a condo complex in Aventura because we did the inaugural Homebound seniors vaccination pilot project launch today. And so what we're doing is dedicating 1,500 doses a week to be able to bring COVID-19 vaccines to seniors who may be homebound or may have difficulty traveling. We try to get the vaccines out to folks in a convenient way, but not everyone can go to a drive-through site. Not everyone can go to the hospital. Some have family who can help them. Not everyone has that all the time. And so we thought it was important to fill a niche. Now, some hospitals have been doing this, and some of the county health departments have been. This is another effort in that direction to be able to make sure that folks aren't left behind. And so what we're doing, and I think it's fitting to say that, to say this here at the synagogue, is we wanted to figure out a way where we could be impactful. So the first 750 doses we're bringing to homebound seniors who are Holocaust survivors. And so I was with a Holocaust survivor in Aventura, Judy Roden, and you know, she was orphaned. She was in Auschwitz. She escaped, and thankfully has been able to live a long and fruitful life. But everyone else in her family was taken, killed in the Holocaust. And so these are folks that, you know, when we did seniors first, we did it because if you look at the effects of this virus, the mortality is concentrated in people who are 65 and up. And if we can vaccinate all the seniors who want it, that's the best tool we have to reduce mortality and to save lives. But we also thought that we owe our seniors. We owe people like Judy and these other Holocaust survivors for serving as inspirations to so many people in my generation and hopefully in my kids' generation. We're thankful for what they mean to this country and what they have done and how they remind us to never forget. We're going to be doing more of those, and I want to thank some of the community groups here in South Florida. We worked with the Jewish Family Service Organizations in South Florida, Holocaust Documentation Center in Hollywood, to be able to identify folks who would be in need of this and would qualify. And then we will continue to do this program in other parts of the state. You know, obviously in Florida, not every part of the state has a lot of Holocaust survivors, so we'll look at other ways to be able to make an impact. But Judy was great, and she's got a great story, and we were happy to be able to bring her the Pfizer vaccine. And of course, the second announcement is why we're here today. So far, We've done 25 vaccine events at places of worship throughout the state, and that's vaccinated over 13,000 individuals. Usually we do them on Sundays, although not always. But this one today is the first faith event where we're doing it interfaith. So you have folks from all walks of life, all different faiths coming together. So we have 175 members of this synagogue. We have 175 members of the Islamic Center of Greater Miami, and we have 175 members of Trinity Church, all coming together to provide vaccines for seniors. And I want to thank all the religious leaders for working together and putting our seniors first. I think it's going to make an incredible difference, and we're going to continue to be doing these events with places of worship. We'll do more this weekend, and we're going to continue doing that. The Rabbi also mentioned making sure it gets in underserved areas. Yesterday, I was out in Pahokee, which is right on Lake Okeechobee, probably as far west in Palm Beach County as you can go. My secretary of the lottery, John Davis, grew up there, and he was a great football player. Now he's the secretary, and he was reached out to by one of the folks he knows who's a great football player as well, Anquan Bolden. They needed to get some more vaccine there. They didn't have a Publix. It was far away. So we went ahead and went out there and did it, and everyone was really happy. And that's what we're looking to do. I mean, we're looking to serve in the most effective ways that we can. So today, I think it's a great day. I think it's exciting. I think it's going to help a lot of seniors here. But we are continuing to put seniors first. We have reported over 1.3 million seniors to receive a shot. The reporting, I remind people, is days behind. So we've probably had certainly tens of thousands more have gotten the shot, maybe even more than that. Of all the vaccines administered in Florida, close to 75% of the shots have gone to senior citizens. And that is the right priority. I look at some of the places. There was something about one of the major cities in the north who had 18% of their vaccinations had gone to seniors. Well, come on, if you want to save lives, you got to get the vaccines to senior citizens. So that's what we've done. We've done about 30% of all seniors have received at least one shot. And of course, we have 4.5 million seniors, so that's a lot of folks to be able to get through. But in terms of the 1.3 million plus reported shots for seniors, that's the most in the country, and it's not even close. I think the next closest state is about 800,000. So we're going to continue to lead on that. What you're starting to see now, and what I said last week would happen, is the second doses for seniors first are coming due. So you're seeing tens of thousands on a daily basis, seniors getting their second shot. The Pfizer started really kicking in last week. Now Moderna's kicking in because 28 days ago is when you started to really see seniors in the community getting shots at greater numbers. So that's a really, really good thing. The second dose is something that we are 100% committed to as a state. I know seniors always have questions about that because I think people say different things. But I can tell you, when the federal government sends us the doses on a weekly basis, and I say we had 266,000, which we had been getting. This week we got 307,000. Those get distributed, combination of hospitals, pharmacies, county health departments, state-supported sites. We've got 350, 400 sites across the state, one in every county at least, where people can get it. So we do that. We also get second doses that get sent, but they go to the places where you did the first dose, and we are not going to take away people's second doses. And so it was said, well, there's doses in the hospital, or there's doses here. Yeah, those are scheduled to be administered. You have people that have already get their card, they make the appointment. We want those doses to be there for them. In order to get 95% efficacy, you have to do both doses for Pfizer and Moderna. To do one does give you some protection. It's better than nothing for sure. But I think most seniors really want to make sure they get the protection of those second doses. And when you're talking about a 95% efficacy, I mean, that really saves lives, keeps people out of the hospital. And even in the small event you get infected, it's almost always been very, very mild, which is really, really good. So we want to continue to just stress the second doses are important. When those come, those are going to the places where you got your first dose. If you have the appointment, if the federal government just didn't send it to us, that'd be one thing. But as long as they're sending it, it's not going to be diverted. It's going to be there for you. So we're now looking to see what we're going to be able to get next week for first doses, and we think that we're going to see another modest but important increase, and that's going to allow us to do some more things, and we're looking forward to doing that. I know there have been a lot of places that have done really, really well. We also finally think that we will see the federal pharmacy program turned on. So we've been waiting for this for a number of weeks. The federal pharmacy program will take doses not involving the state allocation and send them directly to specified pharmacies. And so in Florida, we're looking at Walmart, we're looking at Winn-Dixie, and we're looking at Publix as three that could be able to handle that. So hopefully we'll have some announcements on that at the beginning of the week, but that will be able to expand the footprint further, which would be very, very good for folks. We did expand starting today the Publix footprint to include Pinellas and Pasco counties over in the Tampa Bay area. And so when you're going to get your Super Bowl snacks to watch Tom Brady bring home his 7th Super Bowl, you can go ahead and potentially get your COVID vaccine. We're looking forward to that. So we now have well over 300 public pharmacies in 23 counties, and we're looking to expand that if we can. If the doses are there, we want to be able to expand it. Obviously, if you have Walmart and Winn-Dixie in the mix, that's really good as well. So we're working with them to be able to make that happen. But this is something that's really important. So modest increase in doses, we think, next week, which would be good. We think federal pharmacy program very, very soon, which would be good. Those are tens of thousands of extra doses to each of those places on a weekly basis, we think, which is really good. And then we're going to probably have this week the emergency use application for the Johnson & Johnson vaccine. So the Johnson & Johnson vaccine, the data came in, and this is kind of the perils with sometimes looking at headlines. The headlines were less effective than Pfizer and Moderna. And basically how they got that was they did in their worldwide study, it was higher in the U.S., but worldwide they think it was 66% efficacy in terms of preventing any infection. And obviously Pfizer and Moderna is 95%, so that much is true. But Johnson & Johnson, after 28 days, according to their data, 100% effective at preventing death, and almost 100% effective, practically 100% effective at preventing hospitalization. So to me, that is a heck of a thing to have in our arsenal. If you take the Johnson & Johnson and you know a month later, you'll either not get infected, or the worst that'll happen is you'll have some cold-like symptoms for a couple days, but you ain't going to the hospital, and you certainly aren't going to be in a life-threatening situation. That's an arrow in the quiver that I want to have. So we think that the application is going to be submitted this week. Fast forward 7 to 10. Whenever they submit it, count between 7 and 14 days. I'd say probably about 10 days before FDA meets and hopefully gets the approval. But there is some vaccine that will be ready and